So good evening, sir. So
Good
good
evening,
to
very
see you.
good
It's
evening.
really good to see you using this machine.
Yeah.
So we'd like you to first introduce yourself.
Well, my name is Raj Verma. As you can see, I'm a resident of Vijayanagar, Bangalore. And
So I see you're using the machine even now. And so when did you buy this machine?
yeah, I'm using it whenever I can, in fact.
How long have you been using
Yeah,
it?
I've been using it for the past 1.5 months.
Okay.
It has given me very good results so
Wow.
far.
So results for what? So what were you actually, why did you buy the machine actually?
Yeah, I've been a diabetic patient for the past 20-25 years,
Mhm.
or maybe before that. And for quite some time, I've been on insulin,
Okay.
which I stopped using after some time.
Mhm.
And maybe due to that high sugar levels, my kidneys went for a 6. And finally, doctors put me on to dialysis.
Okay.
I'm undergoing dialysis 3 times a week for the past 3 years, which is really tiresome. And secondly, I'm not able to do anything. Energy levels were very low.
Okay.
And that is the time I was introduced to Mr. Girish Gopal.
Mhm.
He told us that there is a machine called eMedica which will definitely help.
Okay.
And one day he came home, demonstrated to me and explained to me the benefits of that machine. And finally, we bought one machine and started using it.
Wonderful. So, from the time that you have started using it, what are the different results that you're seeing? I know it's a very short period.
Very
but-
short period, but surprisingly, I would like to mention especially the energy levels.
Wonderful.
So on days where I have dialysis, once the dialysis is done by 1:30, 2 o'clock in the afternoon, I am good for nothing. I just come home, crash and sleep. That's it.
Yes.
And I will even skip dinner, speaking to my wife. There is no activities at all, absolutely, till next day morning.
So, is it different now?
Absolutely different. Nowadays, I come home, have little water or whatever is there, I have little, and I sleep. Sleep for 2 or 3 hours.
Mm.
Then I'll get up fresh by 5:30, 6 o'clock, have tea with my wife, watch some TV or something like that. And also I'll eat something or the other I'll eat which was not there earlier.
Wonderful. So, your night,
In-
I think you was having some breathlessness and all that.
Yeah, that was before
Now it is improved.
using this. That was absolutely, that was great actually. I never used to sleep properly especially on Sunday nights and Monday nights.
Breathlessness you had.
I'll sleep for half an hour, 1 hour, then the breathlessness will start, and I cannot lie down. If I lie down, I'm struggling for breath.
Correct.
So I'll come, sit on my sofa, spend the whole night sitting on the sofa, and those were horrible
So,
days.
what about your creatine levels?
Creatinine levels also, I was coming to that.
Hmm.
When I started dialysis, my creatinine level was around 7.5.
Mhm.
Then it remained like that for quite some time. I think it started reducing. Of course, it started reducing. It's reduced to around 6.8 or something like that. That time also I was not using the machine. But then from June, I think in the June first week I bought this machine, we started using it. 2 blood tests I had. Once it was 6.5, then it was 6. Now it is reduced to 5.5.
That's hardly.
That's a fantastic
Hardly
reduction.
2 months, I think.
Yeah, hardly 2 months. 2 months is not completed.
That's really.
So my hope is increased. I'm very positive. I'm also very committed to the machine. Whenever I get them, I use this machine.
So, what about your the sensation in your feet?
Yeah,
sir?
I can come to that. Previously, especially when I wear chappal, that was without ankle strap, when I use it, while walking itself, the chappal will go off my feet. I will not know because there is no sensation at all.
Correct.
Or if I stumble somewhere, if this small cut occurs, or I will not know. Only when it starts bleeding, I will know that chappals are not there, and I got injured and things like that.
So now you're feeling.
That is tremendously increased. That sensation is increased. Now I can feel the ground whenever
the chillness
I
of the
put
ground.
chillness of
Yeah,
the ground.
that's what you were
everything.
saying. That's wonderful.
It's
Has
very
your
wonderful.
urine passing urine on your own, has it improved?
Yes, another aspect. There was no urine passing at all. Previously, maybe once, that too hardly anything. Nowadays, that also improves. Without fail, in the morning and evening, I pass my urine, not in very high quantity, but it's a relief.
Correct.
I
I think that is showing with your weight that they checked when you went for dialysis.
Yes,
right?
yes.
So your improvement was
Improvement is there.
there. So their water retention is reduced.
Water retention is reduced, and I used to get a lot of boils on my legs. Now you can see one here, it is drying up here
Correct, correct.
and here and all. No?
Right.
So nowadays, previously it used to used to come here and there. Now it's increased.
Wonderful, wonderful.
Yeah, I mean that resistance is increased. That means
So
less
you are
less
close to-
kachada is there in my body now.
Yes, you're definitely close to recovery, and really hope that in
Yes.
the next couple of months you're out of dialysis completely.
Yes.
That is the plan for you, right?
My plan is to become a brand ambassador for eMedica.
eMedica. Yes, you definitely will, and we are really happy.
It's a
that
living
it's helping you.
example, right? I want to become.
Thank you so much, sir. I think
Thank
it's
you, thank
helping
you so
you,
much.
and it's helping all of us. And
Yeah,
I'm
yeah,
sure
yeah.
and many will be happy, benefited hearing
I will.
yours.
In
Thank you
future
so
also
much.
I'll help. I'll
Yes.
keep feeding you with feedbacks.
Yes,
or
we
reports
must
and all
get
that.
your feedbacks.
Yeah,
Thank
yeah.
you very much.
Thank you so
Yeah.
much.